So this is a sort of de facto privatization of a portion of publicly covered health care.
We don't have the Minister of Health here to ask him, but I would assume that he would say something like, we just give so many more millions of dollars this time to healthcare, and we don't decide really how much of that money goes into operations of MRIs or on ambulance or whatever. We just decide on the bold part, on the big picture.
But look, the government created the health authorities. The health authorities, the Vancouver Coastal Health Authority, the Vancouver Island Health Authority, these health authorities, they're only the administrative expression of government policy, right? They've been created to deliver health services. They're government agencies. They report to the Minister of Health. The senior executives are appointed by the government. The boards are appointed by the government. The decisions about their budgets are made by the government. So these are government decisions, right? Public health care is defined by the Canada Health Act and the Medicare Protection Act in BC. Should be paid for by federal and provincial taxes.
But you're not willing to say 100%, because then you were not agreeing with the first one.
Well, but I am saying public health care in Canada is defined by those pieces of legislation. It's not an abstraction, right? Mm-hmm, mm-hmm. And so unless you, there's some parts of what one might call health care, like if you're not feeling sick and you say, I want a full body scan with an MRI machine, mm-hmm. I would say to you that that's not something that should be, that's not medically necessary, and that shouldn't be covered by the public system. So if you're a rich guy and you want to spend money on that, that's your business, right? But you want plastic surgery of some sort, that's your choice, but that's not something that should be covered by public health care. And I think everybody agrees with that. So when you say health care, so I say, that's how I say public health care defined by how we've defined it in Canada, the Canada Health Act and Medicare Protection Act in BC, that should be paid for by tax dollars.
Okay, and you're going to go in and fill it in because it's not there right now.
Well, I think that's there.
Which one is that?
That would be number one.
Number one. Okay, so you vote for number one. Let's go to next topic here.
Yes.
Next topic of the 5 topics. The second one says, who should provide it? Healthcare services should be provided by, and you have the first one that says salaried doctors, healthcare professionals, non-profit hospitals, clinics, and labs. And then there's some other answers. But that is at the top of the list.
Right.
Where would you put your vote, or would you create a new one?
Well, just to say that probably the reality is closer to number 2 than number 1.
All right.
Although the reality, the status quo is a combination of 1 and 2, right? Mm-hmm. The status quo is. So the question is whether the healthcare system, the medical services plan, should hire doctors directly or whether it should pay doctors as independent contractors, but public pay. I think the reality is that we negotiate these questions. Mm-hmm. And doctors don't like to call it collective bargaining, but we negotiate these questions with employees as we do negotiate in other sectors. Okay. And the agreements we've negotiated with doctors are fee-for-service agreements. So I don't think the key question in many respects, I think that the shift to salaried doctors is a good idea in lots of places. I think what we have as a reality is a combination of 1 and 2. We have salaried doctors, we have salaried health professionals, we have nonprofit hospitals, clinics, and labs. We also have an element of patient choice. Okay. And beyond that, we have elements of the system that aren't covered, right? So, for example, there's limited coverage for things like physiotherapy, where there's joint payments. That's another question. And those are other questions. That's the scope of it. But what we have is a combination of 1 and 2. So I think it's not just when you're talking about the way we pay people and the way they negotiate their conditions of work, whether they're doctors or whatever. It's not just a matter of imposing something in the system. These things are always negotiated collectively, and I support that kind of negotiation. So it's not something I would impose. I would say that what we have is a combination of 1 and 2. The key question is whether we have a publicly financed system and whether people have access to a high-quality universal standard of care, and that's what I would emphasize.
Would you vote then for number 2, or would you be willing to remake one which combines number 1 and 2?
I think you have to look at a combination of number 1 and 2.
So you're going to rewrite that?
I don't know if I'm going to rewrite that, but I'm saying that the reality is that's the reality of what the system is now.
Okay.
So I think the question, like the question on number 1, if you were just say salaried doctors, right?
So you're saying sometimes, in some cases.
In some, like if you said, if you're voting yes for number 1, as the majority do here, what they're saying is that we should tear up our current contracts with doctors and push all of the doctors to be on salary. And I don't think that's what the people here are saying when they're voting for number 1.
Well, they're saying salaried doctors, healthcure professionals, non-profit. That's what I hear.
But I think, and they're essentially saying that those changes should be made and imposed on doctors and health professionals.
Well, it means that.
I know.
To me, it means that.
But I don't.
But you don't think that that's what they're saying?
I don't think that's what they're saying. They're saying that that's what they prefer. But I don't think they're saying. I think that they're saying that they like, in some ways, the reality of 1 and 2. I think that's what they're saying.
So I'm asking you if you would write at less than 20 words.
You see, it's a big challenge.
And then everybody,
think about that.
all those who mistakenly have voted for number 1 will choose yours.
I don't think they're mistaken. I just think that this is why we have to have public discussion, public debate. We have to have a discussion. Okay, what are the implications of that? Because on the face of it, if I was just looking at that, I'd say I have a hard time choosing between 1 and 2 because essentially it's 1 and 2. We live in an open society, in an open market society, right? And that we have to have a discussion of what the consequences would be of imposing that from above.
What do you think the consequences would be?
Of ripping up our agreements with doctors and that were negotiated over decades and say you have to be salaried doctors of the province of British Columbia?
The changes are happening all the time.
Yeah, I agree.
And I'm sure that you want some changes.
But absolutely.
But that's
I think we have to promote,
yeah.
And I think there's lots of circumstances where we have to promote the salaried doctors. But I'm just saying that I wouldn't agree, and I don't think most people would agree, if you said, okay, well, you're going to rip up signed agreements with doctors and impose a different solution on them. I don't think it would work very effectively because you'd almost instantly have a strike, if you wanted to do that.
Tommy Douglas had that.
Yeah, but he had a strike about something more fundamental, right? I mean, the question would be for people whether it matters to them. If you're going into your doctor and getting a service, as long as it's covered by the public system, whether it matters to them how the doctor gets paid, whether he's getting a regular salary or whether he's getting paid per visit. Either way, those are expressions of public health care. Okay. We can argue which is the most efficient, but I don't think you'd want to blow up the healthcare system based on just that discussion.
I just want to count the number of opinions. I don't want to argue either way. So I just
want to know.
You're not about the
substance. You're about the form. This is an unusual position. You're more like Balzac than Flaubert.
Just want to know where you stand.
Well, there it is.
And you said not number 1 on that one.
Okay. I said number 1 and 2.
Oh, but you can't vote for 2. Well, you're going to reword 1 and 2.
Surely though, everybody understands and believes that these issues can't always be summarized in 20 words.
Sure. Well, people have done here. 4 or 5 people have done it. Yeah.
They have. I'm just saying that you can't always summarize your position in 20 words.
Next question says, availability of services, which we were talking about before with MRIs. You said there's technical gadgets are there, but the staff is not there. So availability of services of clinics, maybe people have to travel too far to get to a hospital.
Right.
Maybe doctors have waiting lists.